Hey guys, it's Big Daddy Liberty here, coming to you from, well, Cape Town, if you can recognize the building behind me, I think being City Hall. I'm here on a simple mission. I want to talk to you, the Cape Townian, you, the ordinary citizen going about your business here in a rather grey and rainy Cape Town. I laugh because, hey man, we were caught in the rain on a few occasions, and we're severely underdressed, if I can call it that. But yeah, as I said, I'm here to have a chat with you, the Cape Townian, about the national health insurance. Do you believe politicians should be controlling healthcare? Do you believe politicians should nationalize effectively all healthcare provision in this country to have essentially the state being the single provider of healthcare? Do you trust politicians to run your healthcare? These are the questions I'll be posing to you, the ordinary citizen. Let's get that conversation going. Hey guys, how's it going? My name is Big Daddy Liberty. You're on the Big Liberty Show. I'm talking to ordinary Cape Townians, every, salt of the earth people, and I'm asking you the question. Government right now is proposing a policy called the National Health Insurance. Now, what the National Health Insurance wants to do is make all hospitals in the country essentially come under the control of government, and all money that is spent on healthcare being controlled by the government. So they decide which clinic you go to, they decide which hospital you get services from, etc., etc. What do you think about an idea like that? Do you trust politicians to run all of healthcare like this?
You know what? No, because in today's life you can't trust politicians, man.
You can or you can't?
You can't trust.
Well, I think a lot of people would agree with you, and my fear is that people like you and me, who maybe save a little bit of money, no matter how much it is, to maybe take the child to a private doctor because you can't wait in long lines in a public hospital, suddenly won't be able to do this because every single health facility will be controlled by government, or not even controlled, but essentially decided upon by government. Is that a good idea? Should we be allowing government officials to do something like this?
No, we're not. You see, because already majority of our people don't want to sit in the long lines, man, So the thing is this: we rather pay for service to be quicker, than to sit in the long lines. Because as you can see, by majority of the clinics and hospitals, you have to wait in a long line. No.
Well, let me put an idea to you. So I'm from an organization called the Institute of Race Relations. One of the alternatives we proposed is, how about to allow poorer residents to be able to buy their own medical aid? And you can get very cheap plans, for example, that can cost as much as 200 Rand a month. Would that be something you would rather do, to have your own medical insurance to allow you to go to a private doctor? Does that sound like a better idea to you?
Yeah, because if you, like you said, I'd rather pay 200 Rand a month. Because if you go, maybe, make an example, today you sick, tomorrow you go, you have to pay to the doctor, you have to pay 200 to 300, 250, 350, you see. So if you had a medical aid, it would be better, man.
All hospitals, all clinics, all doctors in this country would would be paid by government for their services. So they all tell you and you and you where you must go to get your health care, when you can go, and they can even determine our prices that they pay with the hotel. So I don't know, do you guys think that's a good idea? Should we be giving politicians more control over a healthcare aid?
I think it's a right like a government. But you know, when I go to the clinic, figure out so just book or something, but my clinic.
And ladies, ngabe i-idea enhle ukunika udokotela, or rather ukunika uhulumeni i-control of healthcare yonke?
I think it's a good idea to give the healthcare i-chance yoba mayenzele laa nto. Kwenzela because nyhani siyavuka early in the morning, any queues long. Maybe you wake up at 3 o'clock early in the morning, you then you will be helped maybe around 4 o'clock afternoon. Then it's not right. And I think it's the right thing.
If at the moment you have long waiting times, sometimes all nurses are rude to you, etc., etc., would you not want to, and this is my idea and I want to see what you think about it, I would rather a system where imali kahulumeni, or rather imali espendwa uhulumeni on healthcare inikwa nina directly. So for example, ungaphiwa i-voucher. With that voucher, let's say 16,000 a year, when you decide as umzali, you decide as umuntu individual uba uyithenga kuphi i-medical aid yakho, for example, and then kube uwe decide where you get healthcare. What do you think of an idea like that? Would you prefer something like that over the national health insurance? What do you think about that? Is that a good idea maybe?
Nandibona ngayi good idea le, because siyahlala ezikliniki uhambe ekuseni, sometimes uphethe so give up awuse clinic. At least ngayi good idea le. At least umuntu angakwazi uzihambela aziyele ku doctor or e-clinic nge-voucher yakhe.
Okay guys, what do you think? Instead of giving government the power and the resources, instead I give you the power and the resources by way of a voucher, and then when we decide we tenga gupi medical aid yakho, and of course we thola gupi healthcare yakho.
Yeah, I think it's a good idea, yeah, because if voucher at least uzokwazi uyigcina, awuzokwazi uyispenda kwezinye izinto, uyispenda power medical health only.
Absolutely.
Yeah, I think idea right there.
Hey guys, a quick chat again. I know people are waiting for their bus, so I'm not going to get in their way too much. Guys, Sanbonani, my name is Big Daddy. We're talking about national health insurance. Is it a good idea to more power and more resources to control the entire healthcare system?
My brother, it's not a good idea to give them what they already in.
Yeah.
Because of I'm staying in Kailicha.
Yeah.
I'm using the Michael Mapongwane Hospital. Sorry to mention the name of the hospital. If I'm going for night shift because I'm working as a security officer, sometimes it is not right every day you bring a doctor's certificate. Even though you can make it but because of his service, but if I got a medical aid, but in the private security sector, there's no medical aid. But if I can go to my private doctor with that medical aid, I can make time, and I cannot every time have an excuse at work. And the way they spend the money, corruption is too high in South Africa.
The proposal here, instead of Gulument who does the spending on your behalf, instead magube budget yabo, they break it up into vouchers banike wena njengobaba wekhaya to decide where do you buy your medical aid if you want medical aid, or okanye where you find ugqirha wakho, your preferred doctor. Would that be a good idea?
It can be a good idea. Same as I'm a married guy, I've got my children, 2 children. My wife is working. So sometimes if I'm going to take my child to hospital, at least if I'm taking to the private doctor, I spend less time. Although to a clinic, amayeza work. Amayeza work because but on the private hospital or private doctor, you can't get that because you bring cash instead of getting into someone's pocket and he's going to use to, as I said, because of I feel the pain in money.
No, at the moment, if you go to a public hospital or if you go to a clinic, often case fanufika ekseni very early and uzohlala in most cases. So my concern is national health insurance will not fix those issues lezo, even though we'll give our politicians more control over healthcare. I don't know, does anybody else have a view? Do you trust your local clinic, Laukela Corner, ma'am?
No, I
don't. Ladies, do you use or trust your local clinic? Sorry?
No.
Let me ask maybe one more question. If I were to ask you to choose between giving politicians more control over healthcare or alternatively i-budget ye-healthcare yahulumente siyihephule senze ama-voucher for abantu, which would you prefer?
Personal budget, because if I'm the Minister of Health, I'm not the provider family. I don't care about the South Africans. Same as what happens to the former presidents. He doesn't care about a country because I have fit my pockets. I'm alright on my side. I don't care about these people who voted me to be there.
Ladies, he'll rather get the voucher in his own pocket. He doesn't trust government. Do you guys believe that also?
I also prefer a voucher now.
Ma'am?
Voucher less than that.
All right. I see everybody else is a bit nervous to talk, but that's the key issue that I want to raise with the public. Do you trust politicians to control the entire healthcare? So for example, right now, Eskom is a government institution and it runs all of electricity, and we've seen how much of a mess that is. And I'm asking people the same question. If Eskom is a mess, why do we trust government with running the entire healthcare system? I don't know. I'm talking to ordinary people about the national health insurance. Basically, politicians want to take control of every single hospital, every clinic, every medical practitioner, so that government is the single payer of all of those people. Do you trust politicians with something like that?
I don't think so. Why must a person trust him in them? Like now, they use the money like anything. They don't care about the poor people.
Yeah.
They only care about themselves. You understand my point?
Yeah. And that's my concern too. I mean, we've seen what it looks like when politicians control something completely. For example, Eskom is 100% controlled by politicians, and well, that's not necessarily working well, is it? We'll be lucky if we have power when we get home. I've been putting an alternative to people, an alternative vision of what I think healthcare should look like in the country. What do you think about this idea? Let's take the health budget, in other words, the total amount of money spent by government every year on health, break it up into vouchers that we can then give people like you, fathers of a household, mothers of a household, for you to decide where you buy your healthcare, whether it's medical aid or just cash to your favorite doctor. What would you think about an idea like that? The freedom to choose your own healthcare?
That will be not so bad.
Is it a good idea to give politicians more control over healthcare, specifically your healthcare?
Based on how they operate, like Eskom, like you said earlier, with those things, and how the states run, state-owned hospitals are run, I don't think so.
Yeah.
I think it's better to keep it privatized until we improve how the government runs the things. So for now, I'd say probably for the next 10, 15 years, not a chance.
But then I would put an alternative to you. So we all know the private sector provides better healthcare in this country, but unfortunately poor people have no access to it. What if I gave you this idea in order to bring in more poor people? I'm from an organization called the Institute of Race Relations. We write policies and alternatives for government and really political parties. One of the alternatives we've suggested is, how about you take the healthcare budget, break it up into vouchers for ordinary people like you and me. So you could give your dad, your mom, and your sister and your brother a voucher, and you as a family decide where you buy your healthcare or your medical aid. What do you think about an idea like that? Is that preferable?
I think that's a really, really good idea, because it will work a lot better for people who can't afford private healthcare, and it's a good alternative because the state-owned hospitals aren't in such good condition, so I think that would be a really good idea.
Well, hey guys, my name is Big Daddy Liberty. I'm just having a short conversation about national healthcare, the national health insurance. Is it a good idea to give politicians 100% control over your healthcare? What do you guys think? Is that a good idea? Should we be supporting something like this, sir? No?
No, because they don't keep their word on anything. So
Yeah.
how can we trust them now?
Yeah. Yeah. Guys, is it a good idea to give politicians 100% control over healthcare in this country? In other words, for them to tell you where you can get your healthcare? Yeah. All right, so I know you guys are waiting for the bus, so let me put my alternative, and I want to see what you guys think about this. I'm of the view that instead of empowering politicians, instead of empowering government officials, how about we take the money they spend on healthcare, break it up into vouchers, or alternatively bring in the private sector for them to provide cheap medical aid? I mean, we have some private companies that were offering medical aid for 200 Rand a month. How about we bring in those guys to provide cheap medical aid, and on the other hand, break up the money spent by government into vouchers for you to decide where you buy your own healthcare? What do you think about an idea like that?
No, I think that will be a super idea.
Yeah.
It will be because why, and then we can choose where we want to.
Absolutely. Guys, any other comments?
And
No?
you can't use it on furniture or anything.
Yeah, it would be a voucher, so you can't. Yeah.
On health.
Yeah. Guys, what do you think about that idea? It's a fundamentally different way of viewing power. Who should have the power? Should the power go into the hands of politicians or into the hands of you, the parents, for you to decide? Sir, what's your view? No comment? That's all right. Maybe the last sort of group of you guys, what do you think? who decides? Should it be you, the parent, with a voucher in hand, or do we give more power and resources to politicians and government?
I think the parents, I think it's better that way. We can decide ourselves where we want to go, a doctor, and I think that's a better option. For me, it sounds like a better option.
Absolutely. I've spoken to ordinary Cape Townians on this issue, and the central issue is this: who decides? Is it the politicians? And you know me, I don't care who the politician is. It could be the DA, the EFF, or the ANC. It's irrelevant. Who decides? Government and politicians, or ordinary people like these? That's the question I've left to ordinary Cape Townians to answer. I've just finished speaking to ordinary Cape Townians who were waiting for their bus, and their taxis to take them home. Ordinary people, on the one hand, to alert them to the proposed national health insurance policy, and really put the options to them. What would they prefer? A system where there is more government control, more big government, more red tape in something as important as their healthcare? Do they trust politicians to create what is essentially the ESCOM of healthcare? Do they trust politicians to do that? And I think you saw from the vast majority of respondents that the answer is shortly no. And I think there's a healthy mistrust of big government in the public. But we just didn't end the conversation there. We then gave them alternatives that we've been proposing at the IRR. And I'll put a link on the screen here as to our alternative to the NHI that was written by my colleague, the head of policy at the IRR, Dr. Anthea Jeffrey. You can read that, of course, over here on the screen. Have a look at that, because some of those alternatives are what I was putting to the public here. That is devolving a lot of the power away from politicians, away from government and bureaucrats, and putting it into the hands of individuals. How about you get a voucher in your hand that you, as a parent, a individual within the family, can decide where you dispense of it to buy your own healthcare, whether that's a medical aid, medical insurance, or even just paying your doctor directly, your favorite doctor directly. So vouchers were an alternative that we're putting to people, and of course we put the alternatives insofar as if you open up the market and allow competition and allow the private sector to come in, as the birds happily agree with me, and if you allow options like that, you can have private entrepreneurs offer much cheaper medical insurance. I mean, there have been proposals by prospective companies to provide health insurance and is as cheap as 200 Rand a month. We've calculated that as many as 15 million additional people in this country, mostly poor people, would benefit from a system like that. Again, bringing poor people into a quality private system as opposed to saddling them with no options and leaving them in a poor quality public healthcare system. This is the whole issue, I suppose, that we're bringing to people. It's the idea of the freedom to choose. Who should have that freedom? Is that freedom that we should be giving to politicians or to you, the individual, you, the family? And I think a resounding response from people here is they would like that sort of freedom for themselves. Guys, remember, support the work that we do as the IRR. We put these alternatives to the politicians, of course, and ever increasingly to you, the public on the streets. And again, as I said, you can find our alternative on our website. I'll put that information once again on the screen. Please read this, because it arms you with the arguments as to what are the alternatives to an NHI. With that being said, guys, remember to support the work that we do. Support your favorite fat boy. I'm out here in the streets talking to you guys, and you can do that by becoming a friend of the IRR. This is our crowdfunding campaign. How do you become a friend, you're wondering? Well, hey, SMS your name to 32823, and an SMS will cost you 1 Rand. Terms and conditions do apply. Or hey, find us online at irr.org.za/join, and you can sign up a monthly debit order of 90 Rand there. Guys, thank you so much, and thank you for watching The Big Liberty Show. Remember, never trust a commie.